I'm Dr. Matthew Pollard, and I'm here to talk today about carpal tunnel syndrome and carpal tunnel release. There are three main nerves that leave the neck and go down to the hand that control hand function and sensation in the hand. And sometimes those nerves can be compressed. And if a nerve is compressed, you can get weakness or numbness or tingling in the hand. The most common compression neuropathy is carpal tunnel syndrome. That's the median nerve that comes down through the forearm and into the wrist. And in this spot right here, there's a tight canal where it shares space with several of the flexor tendons of the hand. And if there's inflammation in the canal, the nerve can become compressed and people will start to get that numbness and tingling. We usually treat that by bracing and anti-inflammatory pain medications, but sometimes that doesn't work. And sometimes the compression is severe enough and the syndrome is severe enough that surgery is indicated, even sometimes without trying the bracing. So if you have severe carpal tunnel syndrome, we may talk about carpal tunnel release. Carpal tunnel release involves, in the traditional sense, an incision across the wrist. We go down and relieve that transverse carpal ligament, divide it so that there's now no compression of the nerve. And most people notice significant relief of their hand symptoms. Lately, or for the last couple of years, I've been doing the endoscopic version of that, and that's where we make a small incision here in the proximal wrist flexor crease, and through underneath the skin with an endoscopic instrument, we divide the same ligament. That gives a quicker recovery with less pain and works just as well. So anytime you have surgery, there's risk of infection or chance the surgery won't work. Those are extremely unlikely in this very safe outpatient procedure. So if you have questions, be sure to ask, but that's the basic rundown of the endoscopic carpal tunnel release.